We talk a lot about personalised medicine, but I wonder if you can talk a bit about the concept of personalised nutrition.
I think this also makes sense because depending on the environment of the environmental living condition of people, the epigenome will adapt to a particular condition, or the metabolism may be strongly depending on some personal habits. So how someone will digest a particular molecule or a particular nutritional composition or fruit or vegetables may also strongly depend on the epigenome which has been formed or imprinted during his life.
So if you were to give people a certain diet, is there a generally common response to that diet? So we think of health foods as being healthy and fast food as being not healthy, but are there variances in the way people respond to health food or to fast food that you can look at through studying the epigenome?
Yeah, so our original idea was if we could find a common effect or common epigenetic effects which could have any predictive value related to complex disease like cancer, cardiovascular disease, or brain disorders. And we were quite surprised that, okay, there are dietary effects in people, but we are especially surprised that the dietary change is quite individual. The response is quite individual regulated. So if we want to have a common response, we really find very few effect if we take the mean of the whole population. But if we really look to the individual cases, then I think on an individual case it should be possible to link some of the dietary effects to any metabolic disease or complex lifestyle disease.
So what you're really saying that when you do studies to look at this, large populations might be good, but you can't just take the mean of that large population. You have to they have to be stratified in some way in order to uncover the differences.
Yeah, the problem is if you have a diet intervention, the impact of a diet intervention is just a fraction of all the environmental stimuli during his life. So, and maybe also all the other factors will contribute in epigenetic plasticity and epigenetic changes. So it's like finding the needle in the haystack to find really the signature of the epigenetic signature of this diet in the context of your epigenomic variation. And I think if we look to heterogenic patterns between individuals, it's bigger than the impact of the diet. So it's like the dietary effect is hidden within the heterogeneity of the different individuals. And yeah, on the other hand, if you look to cell differentiation, so cell differentiation is rather conserved. So if you look to variability between different tissues, cell tissues are rather robust in having like a cell type specific signature, but within this signature you have a quite individual response of the diet.